Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Good morning, everyone, and welcome to Living Pain-Free. How do we take the surgery out of pain? That's a little conundrum statement, but what it really means is if your doctor has told you you need to have surgery, that probably is not true if it's for an orthopedic situation, such as something like a labral tear, a meniscal tear, a rotator cuff tear, neck pain, back pain. I was just looking at a list of the things that we treat, and it's really the entire body. It's anywhere in your body where you have a musculoskeletal issue and you're having some pain. So all the joints, osteoarthritis, if you have arthritis somewhere and a doctor says you need a joint replacement, we treat those every single day. Plantar fasciitis, that's bottom of the foot pain. Any tendonitis, tendinosis, any ligament pain, the SI joint, bursitis, tennis elbow, golfer's elbow, Baker's cyst, meniscal tears, labral tears, bunions, groin pain, hand pain, headaches, buttock pain, cartilage damage, calcific tendonitis, degenerative joint disease, patellofemoral pain, chondromalacia patella, whiplash, rotator cuff tears, acromioclavicular joint pain, and many other musculoskeletal pain and sports-related injuries. An interesting thing is a lot of people say, well, I'm not an athlete, but I'm injured or I have pain. It's really no different. You can be an athlete or not an athlete. We're all athletes. Everybody who's human is moving around, falling down, all kinds of issues, and we just wear things out. And I think of it, a lot of times people come in and they have these terrible diagnoses from their doctor, and we find most diagnoses are not correct. So you have to be very careful to actually have someone examine you properly, find the pain generator. That's the most important thing. Don't rely on your images like MRIs, CT scans, or X-rays, because they may show something that's there, but it's not contributing to your pain. And the studies are replete on images showing that you can have terrible things on images and not have any pain at all. So be very careful not to slide into a surgery that you don't need. Surgeries are no fun. I had one in medical school while I was doing orthopedic surgery. That was my path. It was on my shoulder, and I tweaked my shoulder weightlifting and had a surgery that really made it horrible. And it wasn't until about 4 years later, when I was a resident at UCA, that I learned about regenerative medicine. Back in the old days, it was called prolotherapy. And I self-injected my own shoulder, and overnight, it was completely healed after a failed surgery and then worse pain afterwards. So be careful. Surgeries are very seductive. They sound like there's an end point, but our patients who come in often have had a failed surgery. So be careful. You don't want one of those. I'm going to give out the phone number to our office. You get a free phone consult with our staff right now, and their phone number is 800-300-9300. That's 800-300-9300. And You can go to our website if you want to watch me doing videos of these procedures, see if it's something you want to do. It sure is a lot simpler than getting a surgery. You just walk in, get an injection, and walk out. You don't need anyone to drive you. You don't need anesthetic, none of the dangers of anesthesia. And the website, you can write this down or you can remember it. Very simple. It's www.stemcellinstitute.com. www.stemcellinstitute.com. And for anybody who calls in to the radio show right now, I'd love to get some callers. You get a free copy of my book, and I'm showing it to the camera right now. That's Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Okay, it's got the foreword by Suzanne Summers, who is a big proponent of my work. I worked on her for years and her family, her son Bruce. A lot of bike accidents for him. He was an avid biker at the time. And his children, and Suzanne Summers' husband, Alan Hamill, a wonderful man. So I've gotten to take care of a lot of very nice people over the years. I've been doing this now for close to 30 years. I was one of the institutors of it back in the day. Obviously, there were people doing it before me, but I picked up on it at UCLA when we had a 1-hour lecture on regenerative medicine. And today it's morphed into using stem cells and PRP for the most part. PRP is platelet-rich plasma, a very simple procedure where we draw your blood, we spin it in a centrifuge, and then we aspirate out the platelets and then inject those in the areas where you're having pain. So we have to be real careful with this stuff. There's a phrase I made up. It's called pathology versus reality. Pathology is what a doctor thinks is causing your problem, and reality is what really is the issue. So back in the day when I had a shoulder surgery, there was an MRI that showed I had, quote, impingement syndrome. So my friendly surgeon, who was my boss, cut into my shoulder and cut out part of the acromion, which is the top of the shoulder bone, and cut some ligaments. Well, that was never really the problem. The problem was really that I had some tendinitis from a weightlifting injury. There's, the rotator cuff is 4 tendons that attach the muscles to the bone to move the arm. So be careful, be careful, be careful, be careful. Never get, for those of you that get a surgery, don't ever do it based on an MRI. Many of the people that have come in who have had a surgery, I ask this question: did the surgeon examine you? And the answer typically, most of the time, is no, I was not examined. I was shown an MRI or a CT or an X-ray of what the problem was. And that is not a good way to do a surgery, because you could be missing the place that actually is causing the pain. That's insane. So I'm going to go to a few questions here. Hopefully we get some callers. If you want to call, talk to me right now. Get a free, what they call a curbside consult. I'm happy to talk to you. The phone number to the studio and talk to me on the radio is 866-870-5752. 866-870-5752. And if you do call in, I will send you a free copy of my book, Stem Cell and Platelet Therapy, with the byline that I love: regenerate, don't operate. That means you can grow back a lot of this tissue and become pain-free instead of operating and taking tissue out. That doesn't make a lot of sense. This book has 264 scientific studies in it, and it's a couple hundred pages long, and it's got a lot of diagrams and photographs, and it can show you how to save yourself from a needless surgery. Okay, so I've got a question here. It says labral tear. Let's see what that means here. Doctor has ordered an MRI for possible labral tear. Pain is getting worse. So typically, when a doctor thinks there's a labral tear, he's wrong, okay? And the typical labral tears that we hear about are in the hip or in the shoulder, And the labrum is like a lip that goes around the bone to hold it in place. So I have a labral tear in my right shoulder. I have no pain in that shoulder. I also have 2 rotator cuff tears, my supraspinatus and my subscapularis. I have no pain. You see my hat? You see the hat? That's a golf hat. See the shirt? That's a golf shirt. After the show, I'm going to go out to Mountain Gate Country Club and play some golf. And I can promise you, I'm not a great golfer, but I have fun doing it, and I'm doing it, pain-free. And you can do that too. So be careful. Just because you have a labral tear that shows up on an image does not mean that is a pain generator. So always have a doctor examine and find out where the pain is coming from. And oftentimes I have to push pretty hard to find that pain generator. I had a gentleman come in yesterday, a brand new patient, and he said he had shoulder pain. So I did an exam of his shoulder. He had no pain in his shoulder at all. He said his doctor wanted to do surgery on his shoulder. Guess what I found? I found the origin of 3 small muscles, the infraspinatus, the teres major, teres minor, and that's where his pain was, and it was attached to his scapula in his back. Okay? It was not his shoulder. So I injected that, and we're going to take a caller. Let's go for it. Hello?
Good morning.
Caller? Good morning. Hi, what's your name?
Jeffrey Constein.
Jeff, how are you?
I am doing very well. How about you, sir?
I am living it up, as I always say. The show is called Living Pain Free, and I'm living it up. How about you?
And I'm living it up too, thanks to you.
Do you have any questions for me? I'd love to hear some questions.
I don't really have any questions. I just want to, let you know that whatever you did for me, it's still working.
Wait a second. Are you the mountain climber guy?
Yes, I am.
Oh my God, your shoulder, right? Your right shoulder was trashed, fractured, and torn tendons. And have you been able to heal up and get back to climbing again?
I have. I've been climbing so much, it's crazy.
Well, you're a crazy guy, and so am I. So that's good. How long did it take you to heal? How many treatments was it?
I think I did about 7, maybe.
Okay. And your case was very extreme because did you fall and fracture it? I forgot exactly what happened. It was a long time ago.
The fall and fracture was after the fact. I was already getting my shoulder worked on by you, and it was already starting to heal.
So you were in the middle of treatment, then you fell and fractured it?
Exactly.
Okay.
Actually, I think I was more near the end of my treatment, and then I fractured it. Yeah.
Wow, but, that's horrible.
As far as your treatment
so typically, let me just say something before you continue, Jeff. Very often, a shoulder like yours when you first came in would be, a couple of treatments or so. But with the fracture, that means that all the tissue is disrupted. And for those of you that have had a fracture that have healed, the soft tissue around it, the tendons and the ligaments, often don't heal. So you can have a healed fracture, but then still have a lot of pain. And that's where we're going to come in. We can help the fracture, putting stem cells and platelets in there. We can help healing. But even after it heals, there are tissues that are called soft tissues. The bone is called the harder tissue. And so it's hard to believe you're actually climbing again.
Yep, I'm back already. I've been back climbing for 3 solid months now, almost 4.
Well, you're an animal. Congratulations.
Well, I put it this way.
So,
the doctor did the surgery on my arm because I'd have a plate put in, said, my x-ray shows my shoulder is shot. You cannot believe I'm back to climbing.
Oh, my God. So the x-ray still looks bad. I'd love for you to, why don't you text me a picture of the x-ray so I can keep a copy of it? I'd love to see it.
I'd rather just come by and show you personally.
Yeah, do it, please. And this is something really important.
Yeah,
in the office, I have please just stop in. In the office, I have photos in every room of a friend of mine who fractured his vertebrae, several of his vertebrae, in an accident on a three-wheeler in the desert in Mexico. He got bumped around, and it looks horrible. And he went to an orthopedic surgeon who wanted to operate on it to stabilize it. And he didn't do that. He got injected instead. And it looks terrible on an x-ray, but he's pain-free. So we have to be careful not to just look at images to decide if a person has or doesn't have pain. So I'm really looking forward, and I would love if you would text me your x-rays before you even get to the office so I can look at them. I'm really excited to see that, because it's a great example for patients to see how people can do with something that looks horrible but really isn't, because the stem cells and platelets can heal a lot of that stuff, even though it's not going to look great afterwards. It's like my own story with my shoulder. I still have tears, labral tears. I have a labral tear on my right shoulder. I have 2 rotator cuff tears, but I've injected myself and I am pain-free. So on the camera right now, I'm waving my arm up in the air to show people what it's like. Well, Jeffrey, keep climbing, man. I'm glad you're doing great, and I really appreciate your call.
As far as your motto, I am definitely living, and my right shoulder is 100% pain-free.
Well, God bless you, man. I'm so happy our treatments helped you. That's great. It's so sad when an athlete like you or any person can't do what they want to do. And this is a treatment that can, get people back. Sometimes it's just people that can't even walk. They have hip pain or knee pain or toe pain. And we can help get them to that. I mean, walking in its essence is a sport. Everybody should get their steps in. For people that can't do much, if they can at least walk, they're going to stay healthy and get their aerobics. I think walking is a great exercise to do. But for guys like you...
I do plenty of hiking, plenty of exercise, and I'm still climbing, which is a miracle.
Well, thank you. Thank you so much for letting people know about that.
And I will be coming back in to have a little spot on my knee we discussed, and I still want to get my left shoulder done because I overcompensated with my left shoulder. And I'm going to have some new funds coming in, so I'll be able to come in starting probably next month.
Love it.
Yeah.
All right, Jeff, I appreciate your call. God bless you, man.
Yeah, I'm just going to say before I go, I was skeptical at first. And you remember my doctor friend, Dr. Mark Spitzer, who came in with me on the phone. And I do. And he basically said, I'm a perfect candidate for this. And so I went in and I trusted you. And guess what? It all worked out. And I'm living pain-free as far as your advertisement goes. This is not a joke. I'm not getting paid to say this. I'm so happy with my life now. You guys basically saved my life. That's it.
Well, that's so sweet. I appreciate that. Yeah. All right. Well, thank you so much. I've got other things I've got to get to here. And God bless you. And keep climbing, man. It's so nice to hear your fractured shoulder is all back together.
It is great. Thank you so much. And you have a good day.
Yeah. So as a follow-up to Jeff's information, and Jeff's shoulder really was, I'm going to use the word trashed when we saw it. He first came in, it wasn't that bad, and we were working on it. In the middle of his treatment, he fell and fractured it, and that would we didn't know if we could help that, but like you just heard, he's back in shape and he's climbing mountains again. So here's a question that came in. This is on the same point. I had a partial shoulder tear in my rotator cuff about 3.5 years ago. I had shoulder surgery. I'm very active and the pain has come back. What do I do? Well, I'm not a proponent of surgery. I have to say that. And, that leads me to believe that this person did not need surgery to begin with, just like I had the surgery on my shoulder that made it worse. So be super careful, people. There are surgeries that do need to be done. and most of them do not have to be. A new study has recently come out. It's in the New England Journal of Medicine. It says if you have a meniscal tear, do not get a surgery for it, because you're going to come out no different than if you didn't do the surgery. So why take the risk of going under anesthesia, having drugs put in you, having a knife put in there, possibility of infection, having things taken out, which leads to another surgery down the road. Be careful, be careful, be careful. That's the most important thing about medicine. Be conservative. If you can help it, don't even go to a doctor. If you have a real problem, get to a doctor right away. But most of the time, a lot of these things just heal up on their own. So our caller, Jeff, happened to say something about our advertisement about helping people get pain-free. We don't advertise helping people get pain-free. There's no guarantees in medicine. And we actually have people sign something on a consent saying that there's no guarantees. And because people have these ideas that stem cells and platelets can heal anything, and they can't. I'm just going to be blunt. We try to pick our patients so that we can heal the ones that we think we can help, and we turn people away. Just because you call in and say you want stem cells or PRP doesn't mean we're going to accept you as a patient. There's a lot of things we can't help. Most things we can, some we can't. So I'm going to give out the number to the studio again. We hope we get some callers. It makes the show interesting. The number to the studio is 866-870-5752. I'm going to repeat it. Write it down. 866-870-5752. And if you want to call the staff and get a free phone consult with the staff right now, they're by the phones and the number at the office, 800-300-9300. That's 800-300-9300. And if you want to go to the website, you can ask me a question right on the website. Every page has a slot for questions. And the website is www.stemcellinstitute.com, www.stemcellinstitute.com. And on the website, there's a page, actually not a page, there's a spot on every page where you can ask me questions. I answer them every day. I get right back to answering questions before seeing patients or after seeing patients. And I stay up late. I answer questions till midnight sometimes. Wake up in the morning answering questions. We want to help you. Dr. Grove, who's not with us today, and I both give out our cell numbers to every patient, and we ask them to please call us if they have questions, day or night. We're very, very accessible. Another thing we treat that people don't know about is we help stimulate new hair growth on the head. It's not going to work for someone like me or Dr. Phil. Once you lose it totally, I wouldn't use PRP or stem cells because it's not going to regrow the whole thing without a ton of treatment. But if you have spotty hair loss or you're starting to thin, it's really an amazing treatment for that. We do quite a bit of stimulation of the follicles using stem cells or PRP. And another thing we do in the office is what's called the vampire facelift, where we inject platelets, PRP, or stem cells into the face to regrow the collagen and thicken up what has been wasting away. As we get older, the body starts to dry out. The entire body is made out of collagen, even the cartilage. So as people get older, the discs in the back start to dry out and they start shrinking, and people actually get shorter. So these are things that we can help, and not making people taller, not that, but rejuvenating the tissue by injecting stem cells and platelets. So there are some reasons for failures, and I'm surprised here we haven't heard the music for the half of the show. Are we at the break? Somebody talk to me over there. Alex, can you hear me? Almost. Okay, so hang with us. We're going to go to a break pretty soon, And if you have questions, please call me after the break. And there's the break. There's the noise for it. That's the banjo music, and I play the banjo, among other instruments. So give us a call after the break at 866-870-5752. That's 866-870-5752. We love you and we want to talk to you, and let's hear from you soon. If you want to call the office, 800-300-9300.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Stem Cell Institute in West Los Angeles. To schedule an appointment, call 800-300-9300. That's 800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment.